Okay, in the last video, I forgot to show you how it looks after the dressing's applied. So as you can see, we have the dressing on the chin to help from the rubbing or the friction from the Cpap device. We also have one on the bridge of the nose and then one on the forehead. Again, it's really important for you to look at your own BiPAP or Cpap device and determine if you need all three of these areas covered. I know most of the time the nurses and wound nurses are indicating that they find the pressure injuries on the bridge of the nose. So most importantly, it should be the nose should be covered, and making a mask again with this size is critical just so that the dressing has more stick to stay in place to prevent the pressure injury and also reduce nursing time for dressing changes. The other important piece of all of this is to do the assessment underneath the dressing. So follow your policies that the wound nurses have in place, but typically, I think it's every shift, the nurse or RT staff will actually look underneath the dressings just to see if there's any skin breakdown. So to do that, you do not have to replace the dressings. You actually can just lift it up, pull it back. Make sure you pull it back as far as you can so you can see the whole area underneath the skin wherever the mask is laying. And just make sure to see if there's any redness going on underneath there. If there is, then just document it in your notes. Then do the same thing, obviously, for your nose. Just kind of peek, look, make sure everything's doing okay. Put it right back down, and then, repeat with the other side. And then obviously do the same thing with the chin. Again, really important to assess anything that you may see and then put the same dressing in place. If it's been 7 days, then obviously you can change the dressing. The dressing has a 7-day wear time. The other thing I'm going to demonstrate to you today is sometimes the forehead and the chin is not needed to be protected because the mask isn't touching those areas. Maybe it's just touching the nose. So what I'm going to show you is how to actually get 2 applications of a nose out of one dressing. So I'm going to make the cuts right now. I'll draw the cuts, I should say. And basically you're just going to duplicate what you did on one side and do the same thing on the other so that you get 2 applications out of one dressing. So here's what the dressing looks like after the cuts are made, and you do have this design also on your template. So feel free to look at that if you need to, and then you're going to make your cuts. So I'm just going to cut the dressing and my little half moons. And I'll do the same thing with the other side. Okay, so now you actually have 2 noses. I usually will then put the other one back in the package, label it with the patient, and then I'll apply the one on the face.